Sometimes, the earliest sign that an elderly person is battling silent depression isn't sadness or crying. It's silence itself, a gentle distancing from people they once loved talking to. Maybe they stop returning phone calls or seem a little less engaged in conversation, even when surrounded by family. This kind of withdrawal often gets dismissed as normal aging or fatigue, but experts warn it can signal something much deeper. Studies show that social isolation is both a cause and a symptom of depression in older adults, creating a cycle that's hard to break. When someone starts pulling away, even subtly, it's worth noticing and gently reaching in. If this topic resonates with you, or if someone you care about has shown even the smallest of these signs, please consider subscribing. It's a simple way to stay informed, support loved ones, and never miss important conversations like this. Leave a comment or share this video if it could help someone else. 1. Withdrawing from family and friends, even in small ways. Withdrawing from family and friends, even in subtle ways, can often be one of the earliest and most overlooked signs of silent depression in older adults. It may begin slowly. Perhaps they start replying late to messages, stop attending social events, or gently decline invitations they once looked forward to. At first glance, loved ones may assume it's just due to tiredness, aging, or simply wanting some alone time. However, mental health experts caution that these gradual changes could be signals of something deeper, emotional withdrawal linked to depression. Unlike what we often expect, depression in seniors rarely shows up as sadness or tears. Instead, it often hides behind smiles at family dinners or short phone conversations, where the person seems fine, yet lacks the spark and warmth they once had. This subtle disengagement is easily missed because it doesn't always come with dramatic signs. Seniors might speak less, avoid eye contact, or appear emotionally distant even when physically present. Over time, this withdrawal deepens. A person who once called every week might now call only once a month. A grandparent who used to prepare holiday meals with love may suddenly stop. These small changes, when viewed alone, don't seem like much, but collectively, they can form a pattern that points to silent suffering. Many older adults hesitate to talk about their feelings, especially if they grew up in times when mental health was stigmatized. This makes it even harder for family members to recognize what's happening. Silent depression often thrives in this emotional silence, and the more disconnected someone becomes, the harder it is to reconnect. That's why it's so important for loved ones to notice what's missing: missed calls, fewer smiles, or skipped gatherings. These may not be signs of aging, but quiet cries for help and connection. Changes in personal hygiene or dress habits. Changes in personal hygiene or dress habits can be among the quietest, yet most telling signs that an older adult may be struggling with hidden depression. These small shifts are often overlooked or misinterpreted. For example, when someone who previously took pride in grooming, brushing their hair neatly, dressing appropriately, or applying makeup, begins to neglect those routines, it might be casually dismissed as simple aging, tiredness, or a relaxed attitude. However, mental health professionals warn that such changes can actually point to a more serious issue. The underlying problem might not be physical aging, but emotional withdrawal, where feelings of motivation, self-worth, or energy have gradually diminished. Depression in older adults doesn't always show up as crying or sadness. More often it takes the form of apathy, a lack of interest, or a quiet withdrawal from the daily rhythms of life. What used to be routine, like showering, brushing teeth, or changing into clean clothes, can start to feel unnecessary or even burdensome. Doctors sometimes refer to this as functional neglect, meaning that the ability to perform these tasks is still there, but the emotional drive to do them has weakened. The changes may seem minor at first: wearing the same clothes repeatedly, ignoring uncombed hair, or mismatching outfits. But they matter. According to research in the International Journal of Geriatric Psychiatry, these signs of self-neglect in seniors are closely linked to untreated depression and may signal deeper, health issues if left unrecognized. Often these signs are excused by loved ones who mean well, assuming their elder is just taking it easy. Yet behind these shifts might lie a message, a quiet cry for help. When appearance begins to fade, it's not vanity that's lost. It may be a sense of visibility, worth, and emotional well-being. Recognizing this early can make all the difference. Loss of interest in hobbies they once loved. Losing interest in hobbies that once brought joy can be a subtle but powerful warning. Sign of depression, particularly in older adults. When someone who previously found happiness in activities like gardening, reading novels, knitting, painting, or doing crossword puzzles suddenly stops engaging with these pastimes, it might be more than just a simple change in preferences. Mental health experts refer to this loss of interest as anhedonia, and it is recognized as one of the primary symptoms of depression. It's not simply about feeling bored or tired. It's about feeling emotionally disconnected from the very things that once brought purpose, pleasure, and meaning. In the elderly, this symptom often develops gradually, making it harder to notice. For instance, an older person may skip one social gathering or hobby group, then another, and over time stop attending altogether. A person who once painted every week might leave their art supplies untouched for months. Family and friends may wrongly assume this is just part of aging or natural slowing down. However, this kind of withdrawal can actually be a sign of a deeper emotional struggle. Research from the Journal of Affective Disorders shows that many older adults who experience depression report a lack of motivation and diminished emotional reward from activities they used to love, even if they are physically capable of doing them. Experts emphasize that this emotional numbness isn't a conscious decision. It can feel like the part of the brain that used to light up with joy has gone dark. Seniors who live alone or are grieving a spouse often feel this emptiness more deeply. Recognizing these signs early matters. Supporting a loved one through gentle conversation or simply being present can help reopen the door to healing. Often, silence speaks the loudest when someone is quietly asking for help. 1. Unexplained aches and pains that come and go. Unexplained aches and pains that come and go can be one of the body's quiet ways of expressing emotional distress, especially in older adults. Depression in seniors doesn't always appear as sadness or tears. It often shows up physically. Some may report frequent back pain, joint stiffness, tension headaches, or deep fatigue that seems to have no medical explanation. These symptoms are real and can be deeply uncomfortable, but they often persist despite normal lab results or clear scans. That's because the root cause may not be purely physical. According to studies in the Journal of the American Geriatric Society, depression in older adults is frequently linked to somatic symptoms, physical issues without a clear medical origin. These include recurring pain that shifts in location or intensity, fatigue that isn't improved by rest, and general discomfort that seems to come and go. Some doctors explain that when emotional suffering is buried or unspoken, the body often becomes the messenger. In seniors, especially those raised in times when mental health was rarely discussed, emotional pain is more likely to be expressed through the body than through words. This connection between mind and body is more than psychological. Research shows that depression can alter the way the nervous system processes pain, making even mild physical sensations feel more intense or persistent. When the brain's chemistry is off balance, it can affect how pain signals are interpreted, causing real discomfort that has no clear injury behind it. For some seniors, these aches may become the only noticeable symptom of an underlying emotional struggle. Family members and caregivers often focus on treating the pain itself, without realizing that the real healing may need to begin elsewhere. When routine treatments don't work and symptoms linger without explanation, it's worth considering whether depression could be contributing. Opening a conversation, offering a compassionate presence, or seeking help from a professional trained in senior mental health can begin to ease not just the body's burden, but the emotional weight behind it. Because sometimes, The ache that won't go away is actually a silent call for care. Sudden fixation on the past or regretful conversations. A sudden and persistent focus on the past, especially on regrets, missed opportunities, or painful memories, can be a subtle yet significant sign of depression in older adults. When an elderly person frequently talks about past mistakes, lost relationships, or moments they wish had gone differently, it may not simply be nostalgia. Instead, it could be a sign that they are searching for emotional closure, even if they don't fully realize it. Mental health professionals note that when the present feels unfulfilling or the future seems uncertain, the mind often retreats into the past, not for comfort, but for answers. This behavior isn't always obvious. It can be as quiet as retelling a decades-old disagreement with a sibling, or repeatedly mentioning a decision they regret. At first glance, it might seem like harmless reminiscing. But if these stories are consistently filled with guilt, sadness, or shame, and if they occur more and more frequently without prompting, it could point to a deeper emotional pain. Studies in the American Journal of Geriatric Psychiatry highlight how unresolved emotions often express themselves through obsessive thoughts, rumination, and self-blame in older adults. Doctors suggest that the mind, in trying to heal, replays these moments as a way of solving pain that was never truly processed. In retirement or after major life changes like the loss of a loved one, there's more time to reflect. And sometimes, that reflection turns into emotional suffering. Families often dismiss this as simple storytelling, but when the tone is heavy and sorrowful, it may be a quiet plea for help. Listening with compassion and encouraging support can make a real difference. Sleeping too much or too little. Changes in sleep, either sleeping too much or too little, can be quiet, yet powerful. Signs that something deeper may be affecting a person's mental health, particularly in older adults. Many people tend to brush off these changes, saying things like, "That's just part of getting older." But mental health experts caution that when sleep habits shift noticeably, such as difficulty falling asleep, waking up much earlier than usual, or suddenly sleeping far more than normal, it could be an early warning sign of depression. These disruptions are not simply about rest. They often reflect the brain's attempt to deal with emotional or neurological stress beneath the surface. For example, if someone who once rose early and had steady routines starts sleeping for long hours, taking frequent naps, or seeming groggy all day, it might indicate emotional exhaustion. This pattern, known as hypersomnia, is strongly associated with depression in seniors. According to the National Institute on Aging, depression can alter the brain's chemical messengers, disturbing the hormones that control sleep and making it difficult to maintain a stable cycle. It's not about being lazy, rather, it's about the body slowing down under emotional strain. Conversely, insomnia can also be a red flag. Seniors struggling to fall asleep or waking frequently may be dealing with racing thoughts, anxiety, or unspoken worries. This poor sleep then leads to irritability, fatigue, and forgetfulness during the day, which further harms emotional health. Because sleep issues are often normalized with age, they're easy to overlook, but they shouldn't be. Sometimes disturbed sleep is the body's quiet cry for emotional help. 7. Appetite changes or unintentional weight loss or gain. A sudden change in appetite, whether a noticeable increase or decrease in how much a person eats, can be a quiet but important signal of emotional distress, particularly in older adults. These changes are often explained away as side effects of aging, new medications, or routine disruptions. However, many doctors caution that when appetite shifts happen without a clear physical cause, they may be tied to underlying mental health issues like depression. When a person begins skipping meals, eating without enjoyment, or showing a general disinterest in food, it may be the body's silent way of saying something is wrong emotionally. Appetite loss is especially common in seniors battling depression or chronic sadness. Foods they once enjoyed may suddenly taste dull, or they may lack the energy or motivation to prepare or eat meals. Some even report forgetting to eat entirely. Over time, this can lead to significant weight loss, malnutrition, fatigue, and further emotional decline. According to research in the Journal of Geriatric Psychiatry, depression often interferes with the brain's reward system, which makes everyday activities, like eating, feel joyless and pointless. Conversely, for some older adults, depression may trigger emotional overeating. They may turn to food, especially sugary or processed items, for temporary comfort, leading to weight gain, guilt, or shame. This too becomes a cycle of emotional and physical harm, whether it's too little or too much. Food-related changes in behavior deserve attention. Rather than focusing solely on meals, loved ones should ask how the person feels. Because in many cases, these appetite changes are not just about hunger. They're about emotional pain looking for a way to be seen. Irritability or sudden mood swings. Depression in older adults doesn't always manifest as sadness or tears. Instead, it can show up as irritability, sudden mood swings, or an unusual level of frustration over small issues. When someone who's usually calm or patient becomes easily angered, snappy, or excessively impatient, it can be a sign of something more than just a passing mood. Research in the Journal of Clinical Psychiatry highlights that, in older adults, depression often presents as anger or irritability rather than sadness. This change in behavior can be confusing, as it may not seem like typical depression at first. Doctors explain that the emotional symptoms of depression in older adults can sometimes be more subtle or even disguised as irritability. When someone becomes easily frustrated, it's often a reflection of internal distress that is hard to communicate. Seniors may struggle with feelings of helplessness, isolation, or exhaustion, but instead of expressing sadness, they may react with sharp comments or abrupt behavior. These mood swings aren't always linked to a specific trigger. Instead, they can seem disproportionate to the situation, which can make it harder for loved ones to understand what's happening. This irritability can be compounded by physical symptoms like sleep disturbances, aches, and fatigue, which may leave the person feeling mentally drained. The emotional toll of these physical challenges can contribute to a shorter temper, even when the cause of the frustration is unclear. Some doctors also suggest that the feelings of disconnection or the loss of control that accompany depression in older adults may contribute to feelings of irritability. When the brain struggles with emotional regulation, even the smallest inconvenience can feel overwhelming. Because irritability and mood swings are often overlooked or dismissed as part of aging, they can be difficult to recognize as signs of depression. But when these behaviors are persistent or uncharacteristic of the person's usual demeanor, it's important to pay attention. Gently checking in, offering support, or seeking professional help can help address the underlying emotional struggle, rather than just reacting to the surface-level irritability. By acknowledging this more complex side of depression, it becomes possible to offer care that can truly make a difference. Difficulty concentrating or forgetfulness beyond normal aging. Difficulty concentrating or memory lapses can sometimes be dismissed as a normal part of aging. However, when these issues become more pronounced or frequent, they may signal a deeper emotional struggle, such as silent depression. Unlike the gradual memory decline that typically accompanies aging, depression-related cognitive issues can appear suddenly and seem out of character for someone. Some doctors warn that these cognitive symptoms are often mistaken for early signs of dementia, but depression and dementia are not the same, though they can have similar effects on the mind. When a person becomes more forgetful than usual or has trouble staying focused, it's not always due to a physical condition like dementia. Depression can cause a noticeable decrease in mental clarity. The brain, when affected by depression, struggles to maintain normal function, including focus and memory. Studies show that the emotional weight of depression can impact the brain's ability to form new memories or retrieve old ones. This disruption can lead to a sense of fog or mental fatigue, where everyday tasks become harder to manage. Unlike dementia, which typically involves a steady and progressive decline in cognitive abilities, depression-related forgetfulness can often be reversed with treatment. When depression is addressed, mental clarity and concentration often improve as the emotional burden lessens. However, If left untreated, the cognitive symptoms can worsen over time, making it more difficult to separate depression from other conditions like dementia. Because the symptoms overlap, it is crucial for family members and caregivers to pay attention to the context of these changes.
If someone's forgetfulness is accompanied by feelings of sadness, hopelessness, or irritability, it's worth considering the possibility of depression. Chants, statements that hint at hopelessness or being a burden, statements like, "I don't,"
"Want to be a bother," or "you'd be better off without me," are not just passing comments. They often reveal something much deeper. These remarks may point to serious emotional struggles such as loneliness, hopelessness, or a sense of worthlessness. Mental health experts warn that when older adults begin to say such things, it can be a subtle but urgent sign of depression. These words are often spoken quietly, even casually, but they should never be ignored. Behind them may be someone silently wrestling with pain, feeling like a burden, or questioning their value to those around them. These expressions often stem from deep emotional guilt or a loss of purpose, especially in seniors who once lived active, independent lives. As they face health issues, retirement, or the loss of a spouse, they may begin to feel like they're no longer needed. Depression can cause them to see themselves as an inconvenience to their loved ones, leading them to withdraw from conversations, activities, or social connections. Over time, this emotional isolation can intensify, creating a dangerous cycle of silence and sadness. Research has shown that older adults are less likely to speak openly about their emotional struggles, often because of stigma or fear of being misunderstood. That's why it's vital to take these subtle comments seriously. Gently encouraging open conversations and showing consistent care can help someone feel seen and supported. These aren't just words, they're signals. And by responding with compassion and professional help when needed, we can truly make a difference in someone's life.